PulManage is a software company that has integrated home telemedicine spirometry with symptom management to provide a platform that health systems can use to manage COPD. Chronic obstructive pulmonary disease, or COPD, everybody's heard about on television, but it is our most costly and most common lung disease. It's just not diagnosed very well.
And back in the day when I used to see patients, it was hard to really pinpoint what was going on with them outside of the clinical setting. And so to be able to help them with their therapy, it was important to gather information from home. Diagnosing lung disease can be difficult, so when you're missing that key component, that spirometry component, it really makes it almost impossible to truly identify what lung disease someone has. PulManage is a software package, but it's a multi-sided software. So the patient uses a mobile application, and then the provider has a web application.
Patients will do spirometry in their homes where they take the biggest breath in that they can, blow it out as hard and fast as they can until they have no more air left. And what that does is lets you measure the amount of air that comes out and how quickly. And as a medical professional, you can look at that flow rate and the volumes and figure out if they have obstructive lung disease or not. There is a symptom tracker on this app that then allows the integration of the spirometry, the flow signals of lung function, with what symptoms are happening in the patient without having to telephone the office and tell them all that's going on. And so we can track symptoms and integrate that with lung function, and that gives the therapeutic implications of what to do. And so to have the telemedicine platform in the physician's office is a way to let these patients remotely monitor, train them, and bring in signals that you need to get the right diagnosis and to treat it correctly. To do this at a patient's home is a real important way to bring technology into healthcare improvement.
What we found is that patients are very engaged with our product. To go through a session takes them about 2 minutes or less after they learn the spirometry maneuver. They feel like it's incredibly valuable for them, both personally to see their results on the application and then to work with their providers.
It was really important for us from the very beginning to make sure that this application was really usable, friendly, easy to navigate for both patients and for providers. It was really an essential component of what went into this.
We've used an application model that's infinitely scalable. It's readily available and with almost no downtime. So the user experience of using the application is always on point.
So at the physician office level, this helps manage patients more efficiently. It means better health care for the individual patient. At the health system level, this means fewer emergency room presentations and hospitalizations. It helps manage your COPD patients with a higher quality of care. And for the payers, it means more efficiency for their resources.
This product that we're building is really going to make an impact, especially as we learn more about COPD and how those folks have been affected by COVID. So we've had multiple rounds of funding from SCRA, and some of those initial rounds of funding really helped determine what our entry-level product would be. One grant in particular was very pivotal for our success, and that was the COVID Tech Grant. So SCRA has been really helpful in helping us to take this thing to the next level. As we release a nationally recognized commercial product, they've been instrumental in walking alongside us down that path.